And I have Anil Joshi with me, who's also going to be helping me with this presentation out here. I have about 60 slides, and I'll try to do that in 10 minutes. Okay, so bear with me. The good thing is that a lot of people really talked about our solution prior to us out here. So it saves me a lot of breath trying to really explain the problem out here. But the problem really is the problem of chronic care management. When patients really get out of the hospital, that's where you lose sight of what the patient is actually undergoing. And it becomes a challenge. They go through a very complex care pathway, and they're touched by many hands out there, and it's very, very difficult to keep track on a regular basis as to how to basically manage these patients out here. So we actually are focusing, we are disease agnostic, but we do have focus on at least diabetes, on cardiac and post-operative patients out there. And that's our primary focus at this point of time. I'll talk a little bit about the solution. I'm not going to go into depth about this particular solution. People have bored you to death about telehealth. It's becoming mainstream. We talked about the fact that CPT codes have been released for remote patient monitoring out here. So it is going to be reimbursed. All of that really bodes very well for the business out here. What problem are we really basically trying to solve out here? Once a patient gets out of the hospital, it's a very fragmented delivery system out there. And a lot of information is not available real time. People go out from the hospital with a certain risk assessment. But then there is no risk assessment done on a patient once the patient leaves the hospital. So there is no ability to understand whether a patient is progressing on that risk or deteriorating on that risk out there. And many a time, they basically land up, again, to the hospital system. Teams are unempowered because they don't share the information. Patient 360 view is not available to anybody in that particular ecosystem out there. It's reactive and it's episodic, as a lot of folks have actually talked about. And then, of course, there's a complete lack of collaboration across this whole care continuum out there. That's the problem that we hope to solve out here. I've just given a conceptual diagram. We are a cloud-based solution, so IntelliH is a platform. It's a cloud-based platform out here. And we have patient monitoring through devices. We collect the data. We can customize boundary conditions for each patient out there. We can understand if patients are going out-of-bound or inbound. We can do continuous risk assessment, which we do through our analytics platform out here. And of course, we do provide a complete view of the patient to everybody who actually integrates into that ecosystem out here. A sweet spot, of course, for us is going to be an accountable care organization, which is a legal entity that actually tries to integrate the entire system. Physically, right now, we can do it through our system electronically, also friction-free. So we've actually done we do the care pathway integration. We do a monitoring of the patients in the care pathway. And we have the ability to be able to predict risk as well as predict any likelihood of an episode to occur out there prior to its occurrence and alert members in the ecosystem out here of its occurrence. Example I just basically want to share with this. Patients really go with an app that they can carry home. We have dashboards for care teams, care providers, home health agencies, SNFs, what have you, throughout the system out there. And they can share their own dashboard out there. They get the data. We actually also give risk factors available. We give prioritization of patients based on risk. So you have the ability to actually prioritize the patient that you're going to actually take care of out there. We have telehealth. If you've got multi-party telehealth, so not only can you get the patient and a care provider into the conversation, you can get a remote family member, you can get a pharmacist, you can get anybody into that conversation with the patient out there. So it's a multi-party telehealth conversation that can take place. We've done this through a standards-based WebRTC solution, as well as we've integrated to Cisco Spark, which is basically a new solution that is emerging in that space out there. And actually, Cisco is in almost 70% of the hospitals in the country out here. Most of them use that collaboration solution out there. So we've integrated that product out there. From an analytics perspective, we've actually done a significant amount of analytics, algorithms inside this. We know medication reconciliation is one of the biggest headaches that actually occurs when a patient goes out of the hospital system. And we have analytics, we delivered analytics to automate that whole process of medication reconciliation. We have the severity transition impact, so we can actually assess a patient's as the severity of their disease condition when they leave the hospital system on a continuous basis. We have interesting health tweet analytics. So when patients are actually sending information about their whatever's going on with them, medication issues or sleep issues or any of those issues out there, we can analyze those text messages out there, and we provide the emotional status of the situation of the patient, since a lot of the chronic disease also has emotional factors as one of the criteria for disease condition and situation out there. So we do that too, and we can actually also provide the hospital readmission risk of a patient once they leave the hospital system out there. Just an example, I just wanted to show you some of the screens that we have out here, the type of analytic reports that are actually generated as a result of this particular solution. And we create reports for different players or actors within that particular ecosystem out there, just to make it relevant for them to be able to act proactively on a patient's situation out there. I'm not going to delve deep into this, but we do have definitely a lot of folks out here in the space. Some are doing pure telehealth, and by and large, telehealth has been what I call as urgent care telehealth. It's business to consumer. It basically assumes that a consumer will call a physician if they have an issue out here, but there's very little that's basically focused on chronic care and management of chronic care and telehealth that is centered around chronic care management out there. And so we focus on that. There are also people who do remote patient monitoring, but we have this combination of providing remote patient monitoring with analytics, with multi-party telehealth out here. And then also creating a shared view of a shared context that is really available to all the folks in that particular ecosystem out there. So our telehealth is delivered through a lot of context about a patient's situation and condition to make that conversation a lot more effective than just an urgent care telehealth conversation. From a sales perspective, we've been in this particular space. And we started our selling process fairly late in the cycle out here, and we are already in deep conversations out here. We've got 2 proposals that are in finalization stage with our customers out here, accountable care organizations. So just to give you a sense of where we are, and I'm going to hand this over to Anil to really talk about the last 3 slides out here.
So I think, when 2 trillion of 3 trillion goes to chronic care management, you would see that a lot of these innovations are happening in this area. And I think, our focus has always been how do you convert a in-person consultation, caregiving to a virtual situation. So the platform that we have created is actually a combination of virtual care and the remote health monitoring with the workflow added to that whole context. So if a care coordinator is talking to a patient, there's a certain type of dashboard that she will be able to see and the data that is coming from the patients. If a physician is looking at those data, then he only has a view that actually makes sense for the physician to look at the data and not a medical assistant or care coordinator. So that's the kind of innovation we have created, such that the adoption becomes much easier, frictionless in the community. Now, I just wanted to ask, a couple questions here. How many physicians in the room actually have done a video call with the patients? 1. How many physicians in the room actually have had their patients monitored remotely? A lot of talk about these things. The point is that I think, for some system to be adopted, it has to simulate their workflow as much as possible what they're used to. And that's what I think our differentiation has been around that. So I think, to summarize what Surendra just talked about, I think what we are actually bringing to the hospitals and the accountable care organization is the very target market, post-acute care, when patients are going home, that's the market we are targeting. Perfect timing, because there's a lot talk, but the adoption has started to take place. The reimbursement policies are now coming in place, so the timing is almost perfect. Not too early, not too late. One other thing that I think we should emphasize, the platform that we have created is a configurable multi-disease platform. Most of the patients actually have multiple conditions. So it's not like diabetes or COPD or CHF, right? I am diabetic, also I have a hypertension. I also have a congestive heart failure. So this system that we have created, you can configure, so you don't have to look at 2 or 3 different systems. Same system could be actually created for a person with single disease, a person with multiple diseases. I talked about the workflow integration. And I think we talked about the traction that we have gotten in the marketplace. In 2 months, we actually have 10 conversations, in-person conversations with the customers, and 2 of them have actually asked us for the price proposal. So that is very encouraging for us in terms of what we are bringing to the marketplace. People have been talking about telehealth and remote health monitoring for some time, but I think this is very encouraging what we are actually showing to the people and what is getting accepted. Differentiation, again, it's the user experience. If the package is not good, people are not willing to look at the content. We have paid a lot of attention to the user experience. Second generation telehealth with AI tools. It's not the video call that we are emphasizing. We are saying, through this video call, can I do some kind of image analytics that tells me something more about that patient? And one of the things that we are trying to do in that respect, actually patent pending, is the medication reconciliation. So we actually have been working on that area. And then again, I think go beyond the alerts, right? Go beyond the alerts, because there are a lot of models, predictive models out there who will actually tell you what is the risk of this patient to come back in 30 days into a hospital. But when the patient actually has gone out of the hospital, are you updating that risk on a timely basis, on a real-time basis? So that's where I think our energies and our efforts are going on. So that's basically it. We are happy to answer any questions that you might have. Thanks.
Yep.
I was just curious, longer term, how are you envisioning that you'll distribute this? What are your channels of distribution?
So the question is, longer term, what are the channels of distribution of the solution?
Yeah.
What are those?
Yeah, so I think, we have 2 strategies here. One strategy is that I think, start with, we are a small company, start with those mid-tier hospitals and ACOs who have the same needs as the academic medical centers. So we are approaching them directly. Our actually bigger vision is what Surendra talked about, collaboration with Cisco's collaboration tool called Spark. Cisco is actually in 70% of the hospitals selling something, but they do not have any clinical solution that they can actually take to their customers. So customers, these academic large hospital centers, are looking for something in that area. So we have integrated Cisco's technologies into our solution such that we can partner and we can go with them there. So that's how I think we are thinking about how to reach the mid-tier market, small and mid-tier, and how to reach the large academic centers. That's how we are thinking about it. Any other questions?
Great.
Okay.
Thank you.
Thank you.
Thank you.